All right, Scott, you should be all set to get started.
Great. Well, welcome everybody. Thought I'd start with a few introductions and then we'll dive right in here so we can maximize our time. So, my name is Scott Eiselt. I am the VP of Clinical Operations for IMC. For those of you who are maybe new to the webinar series or haven't heard about us before, IMC stands for Integrated Musculoskeletal Care, and we're a musculoskeletal healthcare company that provides movement-based care through the form of physical therapy services to individuals. We also contract with various corporations as well. And so many of you on the call probably heard about us through that. Um, this year we're doing a webinar series every other month. And so this is the fourth, I believe, of those. And today we're going to be discussing a common issue, which is lower back pain, probably the most common prevalent issue around the globe. And we're going to talk about specifics about prevention and self-care would be what we're going to try to get to help those of you that um, don't want to have back pain, want to learn more about that piece, but also ways that you can attempt to self-care or seek care if you are struggling with back pain or somebody you know is. All right. So without further ado, I'll kind of dive right in. Um, so what we're going to start, we're going to go through just a kind of a low back overview. What are some facts about low back pain, maybe some misconceptions about it, and then discuss how our lower back works, just the mechanics of the joint, explain maybe some of the reasons why we feel the way we do in our lower back from time to time, and then use those topics to discuss things that we can do to prevent back pain, maintain a healthy back, and then last but not least, talk about things that if we do encounter a problem, what can we do in order to address it without it becoming something significant? Just just what I mentioned earlier, the World Health Organization, this has been 8 years now, and as far as I know, this hasn't really changed, unfortunately. Musculoskeletal conditions are the second largest contributor to disability worldwide, and low back pain is the single leading cause. And so it's a very common issue. It's not, um, only here in the United States of America, but across the globe. And so it doesn't seem to matter what te medical technologies, diagnostic methods, or things of that nature that we have at our disposal, but the incidence and prevalence is still very high. And so some facts about low back pain. So, given that last slide, many of you probably have experienced it at some point in your life or maybe experiencing it now. But there are some things that are important to recognize when it comes to back pain, and you can jump on Google or WebMD and you can read a lot. Some of it's true, some of it is true, but should have an asterisk. So age, age, the incidence of back pain, yes, it does increase by decade as we get older and older. However, it is not necessarily a limiting factor. So it's not, the incidence of back pain may go up, but it does not mean that the ability to manage it, resolve it, or prevent it changes significantly. So even if someone is in their later ages, that does not mean that they cannot resolve their problem or that that's the cause of it. Second is true of the second item on the list as well, degenerative arthritis. So it's a known fact that as we get older, our joints start to then change in their appearance if we were to take an x-ray of those. So degenerative arthritis is common, as we get older and older. Matter of fact, in our 50s and 60s, nearly, greater than 80% of individuals who have a image on their spine are going to demonstrate some level of arthritic change. All right, but 80% of the people in our 50s and 60s don't have low back pain. Okay, so it's not a one-to-one causation. All right, so does it correlate? It can. Can it cause pain? It can, but it doesn't necessarily mean that if you have arthritic change, that you can't then either manage your problem or deal with it and resolve it even. So one way to think about that would be we need to make decisions around care and prevention, not what our joints look like, but how they behave. All right. So an arthritic joint will behave a certain way, and a joint that has a problem in it that has arthritis secondarily will behave differently. All right. And we'll get into that clinical process here a little bit later, but you want to find a clinician or a direction of care that will recognize that we're not going to treat you for your arthritis necessarily, but we're going to treat you based on how your problem is behaving. And that kind of moves right into imaging. We've talked about this in the previous webinars. It has a significant place in terms of diagnostics, but it needs to be used at the right time, as well as at the right, I guess, for the right reasons when it comes to somebody who's struggling with whether it be back pain or joint pain, things like that. All right. And there are different types of images. There are x-rays that show our bones and joint alignment. There are MRIs that show our soft tissues and are more sensitive to those types of problems. And all these have a place. But unfortunately, our more sensitive images, like MRIs, for instance, they're very sensitive in nature. So they can pick up on everything and they can see a lot within, let's say, your lower back joints and the lower back area or region. However, they're not very good at identifying if what they're showing is actually hurting. Okay, so you need a clinician that can connect the two. One way to look at that, someone said to me once a long time ago, an MRI without a clinical context is like taking a picture of a telephone, in that the picture does not tell you whether or not that phone is ringing or making a noise, for instance. All right. So when we take a picture of a joint, it tells us what it looks like, but it doesn't tell us if it hurts, and it doesn't tell us how it behaves when we use it or move it around. Okay, so it has value if we need it. We just need to know a little bit more clinically what's going on before we go down that pathway. So as a result, it's not the best place to start. Okay, inflammation. So I've said, again, kind of a repeat topic here from previous webinars, but you can't turn on the TV without seeing an anti-inflammatory ad, right? You may have had friends or yourself who've had anti-inflammatory prescriptions or injections or things of that nature. And inflammation, as far as the root cause of a musculoskeletal problem, is actually only the root cause, less than 5% of the time, we'll say. Okay, so it's not a dominating force as much as our kind of medical culture would lead us to believe. Now, if you have an injury, inflammation is how your body responds to that injury, or if you have a problem going on, it can be present. Okay, it can cause pain to be more severe. It can make it harder to move around, but it is not often the root cause, but rather a byproduct of whatever is causing the issue. All right. As a result, that's why you hear varied responses to anti-inflammatory treatments. You might have, again, friends or yourself or family members who've had an injection in a joint, and you hear one of them say, "It's worked for me. Hadn't had pain since." You might have somebody else who has, "Yeah, might as well not have had it done. Didn't do anything." Right? Or you get somewhere in between there. And a lot of that is selection. All right. And that if the person would say, "It worked for me," took care of it. Well, that means they had an inflammatory based problem, and the treatment that they were given matched the cause of their problem. As opposed to if you have someone who has what we call a mechanically based problem, one that requires movement based strategies or exercise based strategies, if you will, and you inject that might give them temporary relief or minor change in their condition, but it won't resolve it unless you get to that root cause of correcting whatever mechanically is not working properly. Okay. Now, these last three we're going to dive into because they're important for the rest of the webinar today. So many of our joint issues can be coming from whether it be repetitive movement or prolonged positions, right? And that our life is filled with these. And our joints are meant to move, but they're meant to move through their entire range of movement in all the directions that they have at their disposal. But if we hone in our low back, we often only move in one direction. Okay. When we're sitting, we're in a forward bent position and we lose the arch in our low back. We bend forward thousands of times a day. So the average North American forward bends between 3,000 and 5,000 times a day. All right. Putting our shoes on, loading the dishwasher, unloading it, caring for our children. picking up things around the house. All this is in one direction. Okay, and so we can neglect other parts of that joint, and so we start to then the joint starts to malfunction. So recognizing that and addressing it is very important. Rapidly changeable and reversible. So low back pain is, as many people who suffer with it, it can, depending again on the article you read, but anywhere from 70 to 85% of cases can rapidly resolve. All right. So with the right strategies in place, people can change their condition for a cause and effect strategy within sometimes minutes, but then be significantly better within a matter of 2 weeks. Right. And so we've all experienced this probably. You work in the yard all weekend, and then that night at dinner or the next morning, you can't stand up straight. And it takes you 10, 15 steps to walk across the house in order to get up straight. All right. And then you sit, you feel pretty good. But then while you're sitting, you stiffen up again, if you will. And then, all right, you rapidly change your ability to function. Okay. So that can come in various severities, but it is a very common presentation. All right. Because it's so rapidly changeable, it can also be very preventable, but they are very recurrent in nature. And so we're going to kind of tackle that with some of our strategies today. So that was a lot to throw at you, but all very important topics. So if there's any questions, feel free to put them in the chat, and we'll try to save a few minutes at the end to cover those. All right, diving into the way the joint works. So the joint, a low back joint is made up of, from a simplistic perspective, two vertebrae, which you see here labeled as L1 and L2, okay? And they sandwich a soft tissue disc. All right, that disc is a spacer between those two bones. All right, and the space it creates, you see in the back of the joint where our nerves are exiting, okay, creates space to allow movement between the joint and then those nerves that come out. And it's those nerves that when they get aggravated give us things like sciatica or, let's say weakness or sensation changes in our legs or things like that if we have a pinched nerve in our back, okay? Now the middle of the disc has a soft movable center. Okay, it's soft and it is a shock absorber, but then it is also the reason why we have why it's a spacer. Okay, and it behaves like a ball bearing in between those two bones. And if it's located where it's supposed to, we can bend forward, we can bend backward, we can move side to side without an issue. And then the nerves in the back of the joint have enough space as well. Well, as I stated earlier, we bend forward a lot. So if you look at the right side of the screen, all right, in the forward bent position, which is where we live, all right, that ball bearing in the center of that disc gets pushed backwards to some degree. And when it's pushed there, we're also stretching or elongating the ligaments in the back of the disc and the back of the joint, all right, that are meant to then hold the position, the joint in the right position. As we go through our life, those can actually get a little overstretched and they allow extra movement within the joint as well. This is what would be referred to like as a bulging disc or things of that nature. So when that changes its position, that can then cause disruption in how the joint works, anywhere from stiffness to pain when we move, because there's nerve roots are being stimulated, or even back pain as well as then, pain down the leg. All right, if the nerve root itself is getting compressed. Okay, and so creating an environment that is balanced through our joints is very important to make sure that the joint remains in its normal resting position and that our activities through the day don't cause that to be offset. All right. So here, obviously, what we've already spoken of, a lot of forward bending. We like to sit slouched. We ended up working in a forward bent position, whether that because we're bending forward repetitively or we're at a computer at a desk. Sometimes sitting is thought of as like, oh, it's innocuous. I'm just sitting. There's no activity. But the position in which we sit in actually can have a lot of stress on the joint because the joint is in a different position than it's intended to be in for a long period of time. All right. All right. So the first thing that I wanted to demonstrate as far as prevention, coming off what I just said, is what occurs when we sit. So our low back, all right, which is if we refer to the low back is where our ribs end, from where our ribs end to where our hips start. Okay. That area, we were made to have a slight arch in our back. Okay. Similar to the person in the center here. All right. Now to bend forward, we have to then reverse that arch and move it the other direction, right? Which is fine to do temporarily, but when we sit for long periods, we might as well be sitting bent over. So when we're sitting, our lower back joints are effectively bent over, right? And that position for a long period of time can start to cause stress and strain through the system, and eventually can even change the resting position of the joint back there and cause stiffness or pain or things of that nature. So one easy thing we can do is correct the way that we sit for prolonged periods, okay? Now, what would that look like? Well, moving your low back into an arched position. Okay, so one way to do that is you move as far as you can into that arched position until you feel a strain, and then you back off until the strain turns off, and you should be maintaining still a slight arch in your lower back. Okay, so that would be if you were sitting on a stool or something like that and you didn't have a back support. But that's hard to maintain for a long period of time. So if you look over to the far right side of the screen, you'll see the individual has a lumbar support or a low back pillow that is now holding them in that position. All right, so that would be most office chairs, things like that, have a low back pillow there, or it's curved that way to support you. However, we don't use it that way. So if you sit for work or in your car and you have a lumbar support, you need to push your hips to the very back of the chair so that when you're sitting back against the backrest, it is forcing you into a slight arch in your lower back. This will maintain a more normal position and take some pressure off. If this is new to you, that might be uncomfortable at first. Your back might be like, wow, we're not usually here. That can be an indication that you need to be doing that more. And then I'm going to show you a stretch that can also help that, because your back is not used to that resting position, even though that's a very natural and normal place to be. All right, so that would be low-hanging fruit. We should all do. Quite frankly, if someone asks me like, well, what about kids or what about students? This would be I wouldn't teach them to stretch in any given way. I would teach them how to sit. Our kids are sitting in school, whether that be elementary, middle, junior high, or college in some way. And so we sit starting at a young age for a long period of time. And if they could learn how to sit with supported posture, I think that could make a very significant impact on our kids' low backs. All right, there's a couple videos here. Now, the reason this movement is so effective is because we need to create a balance, and most people end up moving forward most of their day. Okay, this is not intended to treat or care for all back pain. All right, so notice this heading says it's prevention. So if you attempt this and it's uncomfortable, if it's the right thing for you to be doing, it should get easier and easier and feel more and more comfortable over time. If you have a low back condition, you attempt this and it's painful and it seems to be making a condition more painful or aggravating, that's something you should seek care for. Okay, so this is a great tool for prevention. It's also a great tool to identify somebody who needs to have a problem addressed. Okay, so the first way would be to do this laying on your stomach, and you press yourself up, straighten your arms, let your back bend. Okay, and then you cycle back down to your stomach. Doesn't have to be held more than a second or two. All right, it's more valuable to have it repeat itself. The second way is at, let's say, a countertop, back of a chair, something that's sturdy that you can lean yourself against. All right, this way is very effective actually in an older population where they don't feel comfortable getting down on their stomach, but the standing one can be very effective. So same goes, you're going to bend yourself backward over the counter, pause for a second at most, and then come back up. Oop. I'll show that video, sorry about that. Bend backwards as far as you can go, and come back up. All right. Now these movements, like I said, if they feel fine or there's a little tightness, all right, that's normal. You're going to the best thing you can do then is cycle through this about 8 to 10 repetitions a couple times a day. Think about it morning and evening. All right. You establish a normal. And if you do that each day and you try this one time and it's like, wow, that's really stiff today. It's difficult to do. Stiffness is often the precursor to a low back pain episode coming on. So if you can correct it when you're stiff, you can then essentially restore kind of a grace period in your back and keep yourself from getting into a painful episode. Okay. So let's just kind of review what I just said. So if you do this on a regular basis, you know what your normal feels like. And then From there, a couple times a day will help keep that joint balanced. Prepare for the day in the morning with that movement because you're going to do a whole bunch of bending forward, and then clean up after all the activity you did as well. All right. If you have stiffness or pain in doing it, it's recommended you increase the frequency to more 4 to 5 times per day. All right. And the reason for this is if this is the right strategy for you, you should see significant improvement over the course of a couple of days. All right. If you don't, then that is a situation where if you have IMC, for instance, as part of your benefit plan, you seek out either a clinician that's local to your area of ours or a virtual care platform that can help you get your back down the pathway to resolution. All right. All right. Couple other things. So within, and I'll show you a link to this at the end. So speaking of what should I do if I want more services? So IMC offers a Joint Strong web app, okay, that if you had a problem, it can then guide you through a self-care evaluation. So it tells you how to test yourself, and then based on how it responds, it will give you an individualized plan, all right, and then have you check back in with it on a regular basis. Right? If based on how you respond, your problem is behaving as though you do better with a clinical evaluation from someone like myself, a physical therapist, or one of our clinicians, then it'll also identify that based on your response and recommend that you contact us in order to get an appointment. Okay. Also within the app is a prevention portal. So you can go in and click on any joint in the body and learn about preventative strategies that you can then deploy for your own joints. Okay, so it's a wonderful tool. Again, I'll show you the link at the end that you can use in order to familiarize yourself with it and hopefully continue. And those videos I showed you for the low back are in there as well. In the event that you're not responding to self-care and you're beyond prevention, going down a clinical process for some people is very necessary. All right. However, you're going to want to use a clinical process that is going to evaluate your condition to identify what is the best treatment pathway for you to go down. Okay. Our clinical process is one that, based on how your problem behaves, it will tell us over the course of a visit or two, sometimes even in the first visit, that you're appropriate for movement-based care or it's a mechanical problem, and we need to keep working together. Other times they'll demonstrate, hey, you've got a chemical or an inflammatory problem here, and movement isn't going to be able to resolve this on its own, and we need to get you some other type of either medicine or an injection or both. Okay. Other times you might find that, hey, we've got a structural problem here, and I can move you around, but we're not going to be able to correct this. You need a surgical consult, all right, or some imaging and that sort of thing. And so starting at the right entry point can help you get down the right pathway, versus a lot of people don't know where to start. So then they might go to a surgeon first, or they might go to the primary care, try some medicine or things like that. And those are okay. I'm not, saying they're not, but they're not equipped to identify what pathway. It's because they're not trained the same. Okay. So they're trained to identify, are you a surgical candidate for what I can do? Okay. So highly recommend using a clinical process like ours that can get you down the right pathway to recovery. So depending on your benefit plan, you may have an IMC clinician within either one of your work sites or nearby you. If that's something that's available to you, you may know that already. Or when we give you the web app information, there'll also be contact info there, and you can reach out and see if there's someone local. So we have in-person care for those options. Many of you actually, though, are around the country in different areas where you don't have a clinician on site, but we have a clinical network that covers each state within the country. All right, and we do virtual care for all of those cases. This is new for a lot of people, but the clinical process that people need to go through is often self-driven. So if you know how to move in the right directions and how to respond to it and how your problem behaves, you can resolve your problem without the need of a clinician putting their hands on you. Okay. And so, as far as those that are maybe like, I don't know if I want to do virtual care, I assure you that it is an equivalent care to in-person. All right. Matter of fact, so much so as we measured it, and I shared this in the last webinar a couple months ago. And when it comes to the percent improvement someone received, the amount of pain reduction they had, and their satisfaction with care, there is no statistical significance difference between those that went to clinical care and those who did telehealth only. Okay, so I know it sounds new, but it is worth a try if you're suffering from something to go down a pathway that can help you figure out what you truly need, even if it is through a virtual platform. All right, so here's that link that I mentioned a couple times. So feel free to scan that QR code, and it leaves a couple minutes here for questions. Nick, did anybody have any in the chat?
Yes, it looks like there are a few in the chat.
Let me
So
see.
the first question in the chat was, can your lower back hurt also because of a weak core? And the same person also asked, when you spoke about kids, does carrying backpacks hinder or cause back pain at all?
Good question. So the correlation between a weak core and your lower back, it's kind of like the imaging correlation I made earlier, and that can weak muscles directly cause back pain? Well, the weakness doesn't. All right. But if we're weak, sometimes we move differently, right? We don't use good body mechanics. We don't sit well. We can't maintain our posture when we're trying to lift something. And so it's more the downstream effects. So then now those joints are under much more stress and strain than they would be. Um, but the weakness in and of itself is often not the pain producer, right? Now, that being said, if you have back pain, you do a core strengthening program, is it guaranteed to help you? Not in a lot of cases. It depends on the type of problem you have. Now, so core or general fitness, those types of just strength and conditioning programs have been found to be extremely helpful for our musculoskeletal health. But if you have a problem that needs like targeted movement or things of that nature, just getting stronger around it won't necessarily resolve it. Okay, so it's a healthy thing to do. Weakness often doesn't cause the pain itself. All right. As far as backpacks are concerned, I liken it almost to like having a rock in your shoe. And when you walk with a rock in your shoe, it hurts. Well, the walking isn't causing it; it's that there's a rock in your shoe. And so, if someone's struggling with back pain or their activities are causing their back to maybe not work properly, and then you throw a heavy backpack on them, that's obviously going to be uncomfortable. So the load itself, if someone's in a good standing posture, might make it harder for them to maintain that position. I wouldn't make the leap to say that it causes it, but it's definitely a stressor. So you want to then make sure kids have healthy, flexible joints and muscles in that regard in order to tolerate that. Nick, I can see it. I can handle the others here. Um, Neuromuscular e-stim. So if it's used for like TENS, for instance, used for pain relief, it does just that. It kind of confuses the nerves in order to give them a different signal than pain. It kind of jams the pain signals, for instance. All right. However, if there's a root cause to that pain, let's say the joint's not moving well, or there's some other reason why it's hurting, it's not going to correct that. Okay, so those types of systems are going to be used for someone, maybe they have chronic pain or a condition that cannot resolve and they need management or pain management. It is going to be better utilized for that type of application, but not to correct an issue. Um, if you sit most of the day, do you recommend a back brace? I do not. Our joints are meant to move. Okay, so bracing, as much as it might hold you in one position, doesn't allow the joint to go through its natural movement. All right, so that can cause a litany of other issues. And our joints get nutrition through movement. We milk, lubrication and other types of fluids in and out of the joint, and that's a natural process, and it's meant to happen. Okay, so I would not recommend bracing for long periods of time um, in that regard. And the next question, can slip disc be cured using exercises where a person is able to move but feeling some blocks in the lower back? Yes, very commonly the disc gets a bad rap in terms of um, the the types of problems that will often cause. But it's actually one of the most responsive structures. So it can respond very, very well to movement. So most disc problems actually can respond and correct themselves through movement. Yes, I can move the chat. Let me see if I can do that here for the QR code. 1 second. And then if my lower back issues seem more like strained muscles on either side of the spine rather than bone related, how can IMC help? Great question. So if you actually injured a muscle, it'll behave a certain way next to the joint. But then there's also a concept of what's called referred pain. And so a lot of the pain that we feel, let's say, across our whole back, obviously the spine's only in the middle. But if the joint isn't working well and there's pressure on the surrounding structures, it's been found that pain starts to spread away from the spine. So just because the muscles themselves are tight, that may be a reaction, doesn't necessarily mean it's coming from the muscle. Okay. But IMC can help sort that out for you. So we'd be able to identify, okay, what's the best strategy? Where does it seem to be coming from? And then what's the best strategy to address it? All right. So location is only part of the part of the solution. But don't be fooled necessarily where the pain is, that's necessarily the cause. Really simple analogy would be look at people who have heart attacks. Their left arm hurts, right? Or different areas of their body hurt, and yet their heart's right in their chest. Nick, someone's asking about an attendance sheet.
There's not a specific attendance sheet, but we do record. Teams automatically records all attendance for the meeting, so there's no need to sign in or anything like that for your employer.
Okay. What would you recommend for someone who has a herniated disc in the L405 pushing in towards nerves, that size all day? So I'll kind of go back to, so having a herniated disc, some people have that's a painful condition. Some people have herniated discs and it's actually just a finding in their back. So if a herniated disc is causing symptoms, I wouldn't paint a broad brush to, oh, you should do this movement. Okay. My recommendation would be to try the self-care application and see how you respond to an evaluation, or contact IMC and see if you can get a virtual or in-person assessment. Because those that have disc-related problems can often resolve that rapidly, but you need to target it with the right direction or the right type of movement. And so I wouldn't want to give you a kind of a generic movement without evaluating a problem and how it behaves under movement. Can IMC help with pregnancy pain? Yes, if the pregnancy pain is due to a mechanical musculoskeletal problem. All right, so when kind of goes back to the backpack scenario, right? You're carrying more weight, your ligaments are changing to prepare for the birth of a child, and so all that can have a significant influence on how our joints feel and how they work. Okay, and so going through an evaluation to see, hey, I'm having pain in these areas. Can I resolve that pain with movement while I'm pregnant? Or maybe even learn to manage the pains that I have so that I can resolve them once I deliver the baby. Or determine, hey, these are pains that unfortunately are not mechanical in nature. They're just part of the changing of your body. So yeah, we could definitely help differentiate that. Nick, you got a feedback coming off your computer.
Oops, sorry about that.
That's all right. Two more here. Does going to the chiropractor help back from having problems, and how frequently we'd have to go to field results? Great question. So I almost put a slide in on this, but I didn't. I wasn't trying to necessarily throw any discipline under the bus, if you will. So chiropractic care can be effective for people for sure. Part of the reason for that is they're moving the joint. They're moving the problem at its root. Okay, but there's two main issues with it. One, it's often not specific to the way your condition behaves. So there's not an evaluation process that says, hey, this is the right manipulation for you. It's often very much the same manipulation for everybody that comes in to the clinic. And this is, and I know it's because we actually have a lot of chiropractors that work for us and do the same clinical practice we do. The other thing is that chiropractic care is a very dependent approach. Okay, so it takes the power away from the patient. They're not teaching you how to correct your problem yourself and keep it better. So if you go through a process that is attempting to teach you how to self-care and you can correct your problem, you don't need to go to maintenance chiropractic care every 2 to 3 weeks and empty your bank account or, all the things that come with that. Okay, so again, it's not that it doesn't help people, it's that it's a different manner in which it can help. But I think the most effective tool is learning how to correct your problem yourself and care for it. So at 2 in the morning or 2 in the afternoon or on a holiday, you can care for your own problem rather than having to make an appointment and wait till Monday. All right. So that's what the slide was going to say. All right. Last question. If L5 disc was removed but not fused and chiropractic care was only limited short relief, what else could be done? Great question. So if you had a disc bulge or herniation, you had a microdiscectomy, so that means a part of the disc was removed, but yet you're still having problems. One of two things is that may or may not have been the pain generator that was removed, or sometimes it is, but you could be struggling with post-surgical pain, so your body tried to heal itself and is still having issues. And then in some cases, I've seen where when they go in and take the disc piece out that was causing the problem in the moment, there's still some disc fragments within the L5 disc. So they don't take the whole thing. They just take the part that was not where it was. And your body can actually push out other fragments, all right, or start to. And so movement can still, in many cases, all right, so 9 out of 10 times could impact that. And if it was a question of, well, do I need another surgery or an epidural, or can I get this taken care of with exercise? Start with an exercise-based approach. And based on how it behaves, then we could identify, does this seem like it's another structural problem that needs a surgical approach, or can we correct this with a movement-based approach? Hopefully that answers that question. All right. Got a thumbs up. Perfect. All right. I'm going to minimize this for the person who wanted the QR code. So there's that. So if you guys have any, questions that are specific about like prevention, what to do, I highly recommend jumping into the web app here and seeing kind of how it may or may not answer that question. If you have a clinical need or a family member does, even if it's virtual, I know that seems out of the box for a lot of folks, but it is a highly effective means to addressing your issue, or at least a place to start to identify where you should go. So highly recommend reaching out if you have a need. All right, Nick, I think that pretty much sums it up. Thank you, everybody, for coming.